Hi, I'm Jeju, the presenter. There are some mild, moderate, and severe asthma patients around the world. We decided to focus on severe level, which is directly related to life. As a result, we learned that the main reason for severe asthma is derived from problems on M2 receptor. So from now on, we will present to you the whole process about it. We practiced measuring respiratory volumes and calculating capacities and comparative spirometry and effects of surfactants and intrapleural pressure on respiration through the PhysioX, which is a simulating program. However, the third simulation isn't related to our subject, so we will not mention it in this presentation. Please check the attached file for the details. We were able to observe the changes in lung volume and capacity due to the reduction of airway radius in first simulation. This shows how it changes in lung function in the asthma patients. From the second simulation, we learned variable spirometer of normal person, asthma patient, and asthma patient with inhaler. From this data, we weren't able to find or understand some parts, so we searched additional paper to solve these questions. From assessment of relationship between pulmonary function test and dyspnea index in patients with bronchial asthma and function of the neural M2 muscarinic receptor in asthmatic patients, we were able to find the answers that we had wondered earlier, such as symptoms and degrees of asthma and subjective dyspnea index, which contains not only breathing function but also subjective data such as psychological effects, and the relationship between pulmonary function test, which is objective, and dyspnea index, which is subjective, and the causes of severe asthma. We measured lung volume and capacity, which are caused by airway radius reduction from 5 mm to 3.5 mm by reducing 0.5 mm per each measurement. As a result, the more airway radius reduces, the more lung capacity, such as IRV, TB, ERV, VC, or TLC, have decreased. In other words, less airway radius means more difficulty in breathing. When asthma occurs, compared to normal states, TB, ERV, FVC, and FEV1 have decreased. However, the IRV and RV have increased. In other words, less airway radius means more difficulty in breathing. We found that after administering asthma inhaler, most of the data were fully recovered. However, some data such as FVC, IRV, and RV were not fully recovered. Those are the clinical severity of bronchial asthma. Please check. Those are some indexes. And first, there are two types of dyspnea index, VAS and BSDI. They are subjective index, which is sensed by the patients, and there are three types of pulmonary function tests, such as FEV1 or FVC or MMFR, and they are objective index, which is measured by spirometry. Those are the methods. Please check the attached file for the details. VAS and BSDI tends to increase in order of mild, moderate, and severe patients. However, the pulmonary function tests result didn't show such tendency. The smaller PC20, the more sensitive in methacholine. The larger PC20, the less sensitive in methacholine. In clinical status, mild patients tend to have slightly more changes in VAS and BSDI, however, none in FEV1. Those are the methods. Please check the test file for the detail. When M2 receptor is normal in mild and moderate asthma patient, pilocarpine inhalation after administering methacholine, PC20 value will increase. This is a mild asthma patient, and this is moderate asthma patient, and you can see the increasing graph. However, in severe patients, the trouble in M2 receptor, because of the trouble in M2 receptor, even if the administration of pilocarpine PC20 value did not increase, as you can see in the graph. ACH, which is secreted from the cholinergic nervous system and acts on the M3 receptor and thereby constrict the bronchial sinus muscle. And M2 receptor inhibits the secretion of ACH by autoreceptor. And ACH, but if problem occurs in M2 receptor, ACH secretion will increase and it will lead to bronchoconstriction. Bronchial radius is decreased by contraction of bronchial sinus muscle and the secretion of mucous substance in inflammatory response. As a result, normal respiration will be interrupted by the creation of overall pulmonary function. In the case of asthma, bronchial sinus muscle have contracted due to the action of parasympathetic nerve. And because of inflammatory response, bronchial mucous membrane have swollen. Thus, radius of airway reduces, and as the following results, in activity 1, general pulmonary function have decreased. If it is severe, dyspnea might occur. Inhaler is a drug which suppresses the reduction in airway radius. In other words, helps asthma. And beta-2 agonists, anticholinergics, and xanthine-based drug is used in inhaler. So, pulmonary function can be recovered close to the normal status after the inhaler. However, it is not cure, but a palliative, so it is hard to expect to recover up to 100%. Bronchoconstrictor and bronchodilator are injected to asthma patients. At this time, there wasn't change in FEV1, and significant differences were shown in VAS and PSDI. Patients felt considerable differences when they were mild patients. So at the clinical examination, dyspnea treatment should not focus on the perfect treatment of symptom. It should be relief of symptom that patient felt. Therefore, asthma tests have to run, especially focus on subjective data and subjective index such as VAS and PSDI. Dyspnea index does not have importance in clinic of industrial animal, but in a pet clinic, it is important that observe dyspnea mitigation of the animal through the dyspnea index. But that is impossible to measure VAS and PSDI, animal dyspnea index. Anyway, so that it is necessary to develop index to observe animal dyspnea. Bronchial hyperreactivity is caused by bronchial sinus muscle contraction that is triggered by parasympathetic nerve in asthma patients. If trouble occurs in M2 muscarinic receptor, parasympathetic nerve will increase the secretion of ACH. As a result, bronchial constriction will be caused. Trouble in muscarinic receptor, which is a reason of asthma, is related with inflammatory cell in bronchus, so-called increase in eosinophilic inflammation. It is because the muscarinic receptor lose the ability by the combination of receptor and protein secreted by eosinophil. Such eosinophil inflammation occurs critically in severe asthma. Thus, we can understand that trouble in M2 muscarinic receptor is caused by severe asthma. Thank you for listening. If you have any question, please contact us through the email address. Thank you.